Hey you guys, it's Nurse Risa coming back at you with another video on how to glorify God through nursing. So I just came from church and I wanted to come on here and do a quick video of what I felt on my spirit throughout the week. But I hadn't had a chance to really come on here and give you my thoughts on something. A very big YouTuber that I've been watching for many years now. They go by the name of the Daily Davidsons. Tiffany, the wife and mother, on the show, her father passed away from a stroke. And I listened to her story. I've been watching them for a very long time. Very positive young family with 3 young boys. And they've just been a very big inspiration. It touched my heart very closely because I actually also lost my father to a stroke. My father had an ischemic stroke. A hemorrhagic stroke, excuse me. And I believe her father had an ischemic stroke with a clot in his vessels and his arteries. My father, he had a clot that bursted. So I come on here not to just specifically talk about that, but to really say that she did post a video in regards to her experience and what she went through, and feeling as though when she came into the hospital, it was almost like a movie when her father was having a seizure before he had passed away. And how the nurses and the doctors ran in there to help him and everything like that. And so in the midst of the story, she may have mentioned it, but I didn't hear it. But I wanted to come on here and kind of pull at that portion that I didn't quite hear her talk about, because I know she was probably in the midst of everything. But just as someone who's been a patient myself and had my family go through situations where they're crying for me or they're in prayer for me because of whatever is going on at the time, making sure that in the midst of whatever is going on with the patient that you are taking care of, is that their family is also being taken care of. A lot of the times in the midst of a code or a rapid response, we may forget that there's family there, and that their family, though they, they can't come in and help us in a situation, of course not, but they have feelings too, and they feel helpless, and they feel scared as well, especially if they don't have anybody that's there with them and they're there by themselves. Just being able to realize, if you get an extra pair of hands in that room that doesn't need to be taking the vitals or doing compressions or recording or anything else that may be assigned in a specific code that you're in, utilize someone and say, hey, or if you are that person, go up to that family member that may be in the midst of everything going on and wondering what's going on, crying or anything. Love on that family member. One of the main things that we can always do is remember to give family-centered care. Remembering that even in the midst of the most craziest situations, if you have a spare pair of hands, or if you're just a clinical student coming on, you have a very vital role. Instead of just watching them be scared, go up to them, love on them, let them know, hey, can I take you to another space so that you can get your mind together, or can I be with you and take you to another area? Always make sure that we're focused not just on the patient, but we're also focused on the family, because they are an extension of our patient. And that was just one thing that I wanted to pull out of that, because especially in being a nursing student, it can be frightening, especially if you see something and you're new, you've never seen anything like this before, you've never seen a rapid response before. It could be a lot of things going on, especially a lot of facilities have something called organized chaos, where everybody has their role, but it's chaotic. So just always remember that the family is an extension of that patient. And if we take more time to love on them, and just utilize that opportunity to not just see what's going on with the patient per se, but to also make sure that we're going and we're loving on them, and we're giving them the opportunity to have their moment to themselves in a safe environment, and nurturing them in the midst of everything going on, I think that'll definitely turn around everything. For the outcome, not specifically just always for the patient, but for the family and the care that they felt like they were treated with while they were with you in the facility. Whether you're a nursing student or you're a seasoned nurse, or if you're a new nurse, love on that family and give some patient and family-centered care. All right, well, that was a video I wanted to bring to you, and I pray you all have a beautiful and blessed day, and do whatever you can in order to glorify God and bring Him magnification to His kingdom. All right, bye.